I'm Millie Andrews. This is my nursing badge. This is for the NU311 medication administration video, and I'm going to scan the room. Perfect. So first thing I'm going to do is make sure that my medication administration record and my order form are the same. Jaguar J. Jones, Jaguar J. Jones. He was born on August 25th, 1963, August 25th, 1963. His medical record number is 4176352, medical record number 4176352. He's allergic to penicillin. He is allergic to penicillin. The medication I will be giving is morphine, and the medication on here is also morphine sulfate. I'll be giving 5 milligrams, intramuscular, every 4 hours, PRN for pain. Perfect. So everything here looks like it is within the elements of a legal prescription. So now I'm going to move on to my first check for accuracy. I'm going to remove the order form and then start for my first check of accuracy. Morphine sulfate is what I'm looking for, and I do have morphine sulfate right here. 5 milligrams is what is ordered, and this is 10 milligrams per milliliter. So if you do the math, it is half of a milliliter, and I would write that down and check it with another nurse to make sure that's correct. I would do this every 4 hours for pain and intramuscularly. So now for the intramuscular injection, I am going to have to grab the correct supplies, which is a 3 milliliter syringe, a blunt cannula, and the correct needle. So first thing I'm going to do is hand hygiene. I'm going to grab my alcohol pad and wipe down my vial in a circular motion without crossing over the same place twice. Then I'll grab my syringe. And my blunt cannula. Screw it on pretty well so I know that it's secure. First, I'm going to measure to half of a milliliter of air, and then I'll show you. Perfect. And then I'm going to take off the top and inject it. Perfect. Then I will push the air in, flip upside down. Take me several times to get the bubbles out. Can go below just to make sure that it's at the right spot. Okay. So now I have half a milliliter, which is 5 milligrams of morphine sulfate, and no bubbles are in here. So now I am going to scoop the cap onto my blunt cannula and remove it so that I can replace it with my needle. Sorry, it's a little bit difficult. Oop. Place that in my shirts. And I'm not going to touch the top to keep a sterile environment. Okay. And now my needle is in place. This concludes my first check for accuracy. And now I'm going to move on to the second check for accuracy. Oh wait, and that was all legal elements for a prescription. And now it's my second check for accuracy. So morphine sulfate, this was morphine sulfate, and that is what I put into my syringe. 5 milligrams, this calls for 10 milligrams per milliliter, and I put in half of a milliliter into my syringe. And this is every 4 hours. Mr. Jones has not had this yet today, and it is intramuscular for pain, PRN, or for pain. Okay, so The next thing I'm going to do is create my label. Here is my tape. On this label, I'm going to write his name, the dose, and the drug that I'm using. I may have grabbed a little bit too much tape. It's okay. So now I'm going to put it somewhere I can still see the numbers and the label. Okay. And that concludes my second check for accuracy. Now I'm going to move on to the third check for accuracy, and for this I'm going to bring in my vial, my syringe, my alcohol prep pad, and my labels on my syringe, and my gloves are in there, and I'm wearing my goggles. So first I'm going to do is hand hygiene, and I'm going to I'm going to enter my patient's room. I'm going to perform hand hygiene. Hello, Mr. Jones. I am Millie Andrews, a student nurse here at South Alabama. I'm going to check your wristband. Jaguar J. Jones. Jaguar J. Jones. You were born August 25th, 1963. August 25th, 1963. Your medical record number is 417-6352. 417-6352. You are allergic to penicillin, and you're allergic to penicillin on here. Are there any more allergies that you would like to talk about today? No? Okay, perfect. So now I'm going to check this again. This calls for morphine sulfate, and that is what is in my syringe. According to my label, it is 1/2 milliliter. This calls for 5 milligrams, and it is 10 milligrams per liter, so that is correct. Every 4 hours. You have not had morphine in 4 hours, and this is for pain. Perfect. So now I'm going to perform hand hygiene again. I'm going to put on my gloves. I am going to, well, first, this is the ventrogluteal. So I'm going to find the greater trochanter by asking my patient to move his leg up and down, and then I'm going to feel for his greater trochanter, put my palm on top of it, put my thumb facing the groin, my index finger pointed towards the anterior superior iliac spine, my middle finger along the iliac crest, and I would inject right here. So I am going to grab my alcohol prep pad. Going to wipe in a circular motion without touching the same place twice. And then I'm going to use the corner of this to point to where I want to inject. I'm going to grab my syringe, take the cap off, put it in the sharps, spread the skin apart, stick my needle in, and then I'm going to aspirate and look for blood. If I were to see blood, I would have to restart this process all over, but I do not see blood, so I'm going to inject slowly and then pull out fast and put it directly into my sharps container. Then I will hold pressure, light pressure. Okay, perfect. Now I would adjust my patient for comfort by covering him back up, lowering the bed, and raising the side rails. I would check on him to make sure he did not have any allergic reactions, and then I would remove my gloves, go document my findings, how he took the pain, the medication, and then come back in at 30 minutes max to make sure that my patient is doing okay and that he does not have an allergic reaction. So and then before leaving, I would perform hand hygiene. So this concludes my medical administration checkoff. So thank you.